We've known since 2002 that teamwork in the NHS, that poor teamwork in the NHS is associated with a higher mortality. We've known since 2002 that if you have good appraisal systems in your organisation, you'll have a 3% lower mortality rate from fractured neck of femur than if you have poor appraisal systems. We've known since 2008 that top team leadership, as adjudged by the staff in an organisation, translates directly into what patients experience as measured by patient complaints. And we've known for about a similar period of time that if boards address quality and hold executives to account for quality, then quality in those organisations improves. And I guess I'm left with thinking, isn't it time we did something about this? It seems to me that we've forgotten a lot of the really simple basics. So look after the people and they will look after the NHS. And I think that is particularly true of the people that work in the NHS. And of course, those people will then go on to look after the patients.
I think in order for current healthcare reforms to be successful, then we really need to think how we're going to engage and involve the 40,000 junior doctors that we have in the NHS more proactively. And often when we think about or speak about leadership at a system level, it can feel a little bit abstract. And what I really like about the report is that it's got some really tangible examples about how we can begin to develop leadership from an earlier stage in clinician training.
We need a strategic intervention around leadership behaviours that will make the system operate. And that's why we have an NHS Leadership Academy. It will be describing what good looks like and will encourage and support a consistent approach to leadership behaviours, which will bind the system together in the same way that we have that for, I don't know, regulation and tariffs. So the world that we live in is dominated by those things like tariffs and regulation. In the future will be dominated by the way that you, I, others behave in the system.
I think we have forgotten in the frenzy of performance management just what an incredibly difficult job people do in the NHS on a daily basis. My favourite mantra that I've been using for the last probably 10 or 15 years is that actually leadership saves lives, and the great thing now in the current climate is it also saves money too.
This isn't just the nice thing or the right thing to do. There's actually a really sound business case that underpins it, that by involving doctors in specifically service improvement, we will do a better job for our patients and we will get better outcomes as a result.
We'll need lots of pace setting going forward, but I personally think another attribute of leaders that we don't see enough of is vision. What works is a breadth, a depth of ability, and where we see leaders really work well, we see the judgment of what to use at what particular time being the difference between mediocrity and great leadership.
Engagement is clearly important, and if you look at the questions in the staff survey that matter, I look forward to going to work, I'm enthusiastic about my job, and time passes quickly. And if you just ask yourself on a day when you feel like that, just how much different you are than a day when you don't feel like that.
I have some statistics from quite a large study that was done in the NHS, which found that the majority of junior doctors in the survey didn't feel valued by managers. They didn't feel valued by their chief exec. Perhaps surprisingly, the majority of them didn't feel valued by the consultant in the clinical team they were working. The good news is that over 90% of this group of 4,000 junior doctors that were surveyed did have ideas for improvement. So there's a really enthusiastic cohort of emerging leaders coming through.
If this ultimately is about transforming services, absolutely changing fundamentally how we approach patient care, we'll need to work very closely together with not one body be able to say it's got to be in this way. It'll affect the combination of CCGs, the Commissioning Board, Health and Wellbeing Boards, the NTDA, Health Education England, and so on and so forth to make it work on the ground. This will take some time. So in terms of managing expectations, I think it's absolutely right. It is common sense. It's a great opportunity, but we know that behaviours take far longer than building new buildings or setting up new organisations.
I think we need to respect, value and look after the people who deliver that exquisite compassion, and, as it says in No More Heroes, we need to look after the people who create the systems which allow us to get on and deliver that sort of care. It's not an either or, we need both. This report is evidence-based common sense. but it is evidence-based. It's much about discretionary behaviour, and it's much about us as individuals as it is about our organisations. And much of it, as I said earlier on, is free and cheap, and get it right in the patient's benefit.